My name is Vera Ora and I was diagnosed in 2005 with breast cancer. I never had a lump, I never had any problems, illness or any symptoms. Maybe because of my background as a GP, I think I was more aware, but I think my intuition has played a role, which maybe made me go to see my GP and ask for a mammogram. At that time I was 39. My fear turned into reality at that point. I couldn't wait to be discharged from hospital after the operation, obviously, because I didn't want to be there in the first place anyway. And I was really missing my family. I felt isolated and I felt that in my head I don't belong there. It took me a while to be able to look myself in the mirror and to perhaps just, gain my confidence and feel comfortable and be, intimate with my partner again, because obviously treatment finishes and comes to an end at some point. However, the scarring doesn't go away, it's always there. People experience different side effects, but the tiredness is really crippling, and the sickness, and the most devastating thing I think for every woman is losing hair. And I lost quite a bit of hair, but I mean, thanks God, after a few weeks it grows back again. But it's just really a main point that every woman fears about, because that's what you wear. That's what you style in the morning, that's how you walk around. So that's the main side effect that I think affects majority of women. It certainly did affect me. I personally didn't want to see people, didn't want to mix with others, I didn't want to go out, I didn't want to talk about the illness. But for me, it was a bit kind of a different scenario, because when I moved to this country, I was aiming to gain my qualifications here. So I did have my exams set up. So my focus was to study and do those exams. And I was lucky that during my recovery, I had to take my mind off things. And I think that was my focus and just gave me a future to look forward to. So I was really pleased because I managed to pass my exams then, and I'm able to work as a doctor now. Being a doctor, I think sometimes works against you. It's just, it was tricky. I'm grateful for the knowledge I had about the illness, but that didn't change much. It's just I was more aware of the treatment and support that I needed. However, it's good to have the knowledge. I definitely recommend that women do gain more information about their illness, to take control of the treatment, take control of their life, be aware what's coming and how to deal with anything in the future, whether that's a reoccurrence or any symptoms. That's really important. Boosting confidence tips, I think, would definitely be to, first of all, be happy in yourself. So that's the mind-boosting kind of advice. And the second, I think being active and looking good in yourself, which exercise does, I think is really important. So I think I applied that, and I think I feel great and look great.